Today, more than ever before, people like you are taking an active part in decisions concerning their health care. To make your decision, you will want to understand your health condition and the options available for diagnosis and treatment. In this program, I will present important facts about the procedure that has been recommended for you, laparoscopy. I will explain in detail what you could expect concerning this procedure. To be informed about laparoscopy, you need to understand your medical problem, the recommended procedure to diagnose or treat your problem, the risks involved, the alternatives to the procedure, and the effectiveness of the procedure. Laparoscopy is a technique used by gynecologists, general surgeons, and gastrointestinal specialists to diagnose and treat medical problems affecting the abdominal and pelvic areas. Without major surgery, it allows your physician to look directly into your abdominal and pelvic cavity through a lighted tube called a laparoscope. Laparoscopy may be indicated for patients to determine the cause of unexplained pelvic or abdominal pain, to determine the reason behind irregular menstrual periods, to determine the reason for difficulty in becoming pregnant, to evaluate inflammation in the pelvic area, to diagnose ectopic pregnancy when the baby is outside the womb, to evaluate the diaphragm for cancer spread, or to investigate or drain fluids from pelvic masses that have already been located by examination, X-ray, or ultrasound. Laparoscopy may also be used as a method of treatment, most commonly to assist in the cutting of the tubes leading to the womb, called fallopian tubes. This is called a tubal ligation. In preparation for a laparoscopy, you will probably be given a complete physical examination, including a pap smear and an internal examination. You will have certain blood and urine tests taken. You may also have a chest X-ray and cardiogram, depending on your physician's preference. For the 8 hours just before your laparoscopy, it's important that you do not eat or drink anything at all. Before the procedure, you will need to go to the bathroom. You may be given an enema if you have any difficulty. To prevent infection, you may have part of your lower abdomen and groin area shaved. Your anesthesiologist will discuss with you the type of anesthesia which you will require. This is a general anesthesia. The day of your surgery, you may be given some medication to relax you. Then you'll be taken into the operating room. An IV will be started. Your anesthesiologist will then inject medicine to put you to sleep. Next, your legs will be put into the stirrups, your belly and vagina will be prepared with an antiseptic solution, and you will be draped except for your head and a small area below your navel. Just prior to or after your laparoscopy, you may be given a D&C, or dilatation and curettage. This involves a scraping of the tissue that lines the inside of your uterus. Information obtained from a D&C may help your physician understand the nature of your problem. To prepare you for the laparoscopy, an instrument will be inserted through your cervix and into your uterus. This instrument may be used to move the uterus so that your doctor can better view your pelvic organs during the laparoscopy. Then a Foley catheter will be inserted into your bladder to remove any urine. An incision will be made about 1 inch away from your navel and a needle inserted. The positioning of the needle will be carefully checked to be sure it's placed away from your major blood vessels. About 2 to 3 liters of a harmless gas, usually carbon dioxide, will be pumped through the needle into your abdominal cavity. This gas lifts the wall and lining of your abdomen so that your doctor can see inside more easily. After the gas is pumped in, the needle will be removed and an instrument about as big around as a pen, called a trocar, will be inserted into your abdominal cavity through the same opening. The trocar will be used to insert a collar into your abdominal cavity. Then the trocar will be removed, leaving the collar in place. The laparoscope may then be guided through the collar into your abdomen. The table will then be tilted so that your head is lower than your feet. This position will allow your doctor to have a clear view of the pelvic organs. After turning on the light at the end of the laparoscope, your doctor will move the scope around, exploring the uterus, tubes, ovaries, and the rest of the pelvic area. The laparoscope may also be used to examine the liver and other abdominal organs. Also, minor surgical procedures can be done during a laparoscopy. They include removing fluid or blood by suction, removing very small adhesions, and draining small ovarian cysts. If you're having a tubal ligation or cutting of the tube leading to the womb, a second cut will be made and a smaller trocar and collar will be inserted. Through this smaller collar, your doctor will insert the instrument used to operate on your tubes and perform the tubal ligation. Upon completion of the inspection or treatment, you will be returned to a horizontal position, and the collar with the laparoscope and any other instruments will be removed. The carbon dioxide will be expelled by gently pressing on the abdomen. Your skin incision will be closed with stitches. You'll be taken to the recovery room where you will be watched very carefully until you awaken completely from the anesthesia. Then you'll be returned to your room and watched for a period of time. Following laparoscopy, you may have some abdominal or pelvic pain. This is usually caused by some gas remaining in the pelvis or abdomen. You may also experience some pain where the laparoscope entered. Temporary shoulder pain is also not uncommon. These pains should ease within 12 to 24 hours. If severe pain develops, or if you have pain for longer than 24 hours, report this to your nurse or physician so that you can be examined. The chance of any complication occurring with your laparoscopy is probably less than 1 in 100. The chance of any specific complications are as follows. There is a 1 in 200 chance of bleeding inside your abdomen or from the external site where the laparoscope was inserted. There is a 1 in 600 chance that your womb or uterus may be torn or punctured. There is a 1 in 1,000 chance of a serious injury to the bowel, which may require surgery. There is a 1 in 1,000 chance that you may develop an infection after your laparoscopy. There is a 1 in 5,000 chance that you may develop a hernia. And there is a 1 in 2,500 chance of heart failure or cardiac arrest, which could result in death. When used for sterilization purposes, laparoscopy has an overall complication rate of less than 1 in 100. Specific complications are similar to those just listed for laparoscopy when it is used to diagnose problems. Because laparoscopy requires a small cut on your abdomen close to your navel, there is a chance that you may develop a small scar in the form of a crescent. Laparoscopy is an invasive procedure, meaning that it involves opening and entering your body with instruments. Laparoscopy will be recommended for you only when less invasive alternatives already have been tried or would not be effective in the judgment of your physician. The type of laparoscopy described in this videotape is a closed laparoscopy. The main alternative to a closed laparoscopy is an open laparoscopy. In the open procedure, after making a cut into the abdomen, your physician will insert his finger. This allows your doctor to investigate the relationship of the organs in your abdomen with each other prior to inserting a trocar and collar. Then gas is pumped through the collar into the abdomen to allow your doctor to see your organs better. A rounded trocar is used for open laparoscopy, unlike the straight one used in the closed procedure. Once the collar is in place, the two procedures are very similar. Open laparoscopy is preferred by some doctors in certain situations. You and your doctor should discuss which procedure is best for you. A technique that is often done prior to laparoscopy is hysterosalpingogram. This is an X-ray type procedure that uses dye to detect abnormalities of the uterus and the fallopian tubes, which might be responsible for difficulty in becoming pregnant. In addition, ultrasound may also be used to locate other abnormalities in the pelvis. If these are not successful in diagnosing your problem, then a laparoscopy may be required. In some cases, if your physician thinks that the indications for an operation are clear, the better choice may be to proceed immediately to surgery without undergoing laparoscopy. If you don't have a laparoscopy or any alternative procedure, you may continue to have the same problem for which you consulted your physician. You will have no new useful information about what's causing your problem or how to deal with it. More importantly, you could be seriously injured or even die as the result of conditions such as the rupture of an ectopic pregnancy, which possibly could have been identified by laparoscopy. The main benefit of a laparoscopy is that it allows your physician to have a direct view of the organs within your abdominal and pelvic cavity without opening your abdomen. More than 80% of patients who complain of pelvic pain can have the source of their pain successfully determined by laparoscopy alone without further surgical procedures. There is only a 1 in 500 chance that women sterilized with the assistance of laparoscopy will ever become pregnant afterwards, regardless of their level of sexual activity. To summarize, laparoscopy is an effective procedure which allows your doctor to look directly at the organs within your pelvic and abdominal cavity. Additionally, tubal ligation and some minor surgical procedures, such as removing small adhesions, can be performed during laparoscopy. With knowledge gained from laparoscopy, your doctor may often be able to diagnose and sometimes treat your problem. Please review the guide which accompanies this videotape and answer the patient quiz. Be sure to consult with your doctor on any questions you may have concerning laparoscopy. Being informed enables you to make the best decision concerning your health care.